Okay, let's dive in. We often think about bone problems like, simple breaks.
Right.
But imagine the blood supply to your bones getting cut off. What happens then?
Well, that's when things get a bit more complicated. It can lead to something called avascular necrosis. Sometimes people call it aseptic
Oh,
osteonecrosis.
vascular necrosis. Get
Okay,
it? Okay.
basically it means bone tissue actually starts to die because it's starved of blood.
Like a part of the bone just withers
Yeah.
away. That sounds serious. Where does this usually happen?
It can occur in different bones, but the sources we looked at really point to the femoral head. That's the ball part of your hip joint. That's the most common spot.
Yeah, the hip.
But, it can definitely affect knees, shoulders, even ankles, too.
And what's the impact on someone? Is it just pain?
Well, the pain is a big part, often really intense, and it can get worse over time, making it hard to function, especially in those weight-bearing joints like the hip or knee.
So it can be quite disabling.
Absolutely. And it often hits adults who are still pretty active, maybe in their 40s or 50s, so it can really disrupt life if it's not caught and managed.
Okay. So using the materials you gathered, our goal here is to really unpack this for you, the listener. We want to understand how it's diagnosed, the staging, what treatments are out there,
Right.
and especially look at some of the less invasive approaches like hyperbaric oxygen therapy.
Exactly. We'll try to make sense of it all.
So starting with diagnosis,
Mm.
how does it usually begin? Is it obvious?
Often not, actually. That's the tricky part. Early on, it might just be some subtle pain. Maybe you just brush it off initially.
Like an ache you ignore?
Kind of, yeah. But then it tends to worsen, especially when you put weight on that joint. It can even get bad enough to wake you up at night.
Okay, so if the early signs are subtle, how do doctors actually, pinpoint this condition before it gets really bad?
This is where imaging becomes absolutely critical. Um, the sources consistently highlight MRI as the gold standard for catching it early.
MRI. Why MRI specifically?
Because it can see changes inside the bone, like swelling in the bone marrow, what's called edema, long before anything structural would show up on a standard X-ray.
Ah, so it sees the trouble brewing before the bone itself looks obviously damaged on a regular film. Makes sense.
Precisely.
Once they suspect it or confirm it with MRI, how do they grade how severe it is? Is there a scale?
Yes, there is. Doctors often use a staging system, frequently the Ficat classification, especially for the hip. It's based on what they see in the imaging. Think of it like levels of damage.
Okay, levels. What's the first level?
So class 1, you've got pain, but the X-ray looks totally normal.
Still invisible on a standard X-ray then.
Right. Then comes class 2. Now you start seeing things on the X-ray. Maybe some areas look denser, or you see little cystic spots, some porosity. The bone structure is clearly altered.
Okay, changes are visible now. What about class 3?
Class 3 is a critical stage. This is where that femoral head, the ball of the hip joint, starts to lose its shape. It begins to flatten. Yeah. And you might see something called a crescent sign on the images. It looks like a tiny crack just under the surface. It's a big warning sign that the bone is weakening and could collapse.
That sounds precarious. And the final stage, class 4.
Class 4 means the collapse has happened. The femoral head is caved in, essentially, and the space in the joint starts to shrink. The damage is pretty significant by then.
Okay, so the treatment approach must really depend on which class you're in.
Absolutely. For those early stages, class 1, class 2, maybe early class 3, the main goal is trying to save the joint. Joint preservation.
Keep your own hip, basically.
Exactly. But once you get to that class 4 stage where the bone has already collapsed significantly, the sources are pretty clear.
Surgery.
Yeah. The most reliable fix at that point is often surgery. Usually a total joint replacement, like a total hip arthroplasty, getting a new hip joint.
Right, if the original is too damaged. But let's back up to those earlier stages. What options are there before it gets to collapse? Things to stop it or slow it down?
Well, there are a few routes. Medically, you might use pain relievers, anti-inflammatories, to manage the symptoms, but they don't fix the underlying blood flow problem.
Just managing the pain.
Right. Bisphosphonates are sometimes used to their bone-strengthening drugs, but the sources do mention a rare, though serious, side effect with the jawbone.
Okay. What about non-surgical procedures? Anything less invasive?
The sources mention things like shockwave therapy and pulsed electromagnetic fields. These are non-invasive ways aiming to sort of stimulate bone repair and reduce pain, sometimes used with other treatments.
And surgically, but maybe not a full replacement yet.
Yes, there's a procedure called core decompression.
Core decompression, what's that involve?
Think of it like drilling tiny channels into the affected bone area. The idea is to relieve the pressure inside the bone, which can ease pain and hopefully improve blood flow.
Ah, like relieving pressure buildup.
Exactly. It's often considered for early lesions, like class 1, or sometimes combined with other things like injecting platelet-rich plasma or maybe bone marrow concentrate, especially for younger patients in later stages, to try and, buy some time before needing a full replacement.
Okay, that gives a good overview of the range, but the sources seem to give special attention to hyperbaric oxygen therapy, or HBO2. What is that exactly?
Right. So hyperbaric oxygen therapy involves breathing 100% pure oxygen inside a pressurized chamber. The pressure is higher than normal air pressure.
Pure oxygen under pressure. How does that help with AVM?
The idea, supported by the research in the sources, is that this dramatically boosts the amount of oxygen dissolved in your blood plasma.
So more oxygen gets carried around.
Way more. And this super oxygenated blood can then reach areas where circulation is poor, like the bone affected by AVN.
And what does that extra oxygen do for the bone?
Well, the sources suggest several potential benefits. It might reduce swelling and that high pressure inside the bone marrow, which helps with the pain.
Pain relief.
But crucially, it might also stimulate the growth of new tiny blood vessels, angiogenesis, and encourage the bone-building cells, the osteoblasts, to work better. So potentially helping the damaged bone actually heal and repair itself.
That sounds quite significant if it works. Where does HBO2 fit in the treatment plan based on the sources?
It seems most promising for the early stages, class 1 and class 2. The studies mentioned showed pretty good results like good recovery, pain control.
So using it early could make a real difference.
That's the hope.
Yeah.
It's also suggested as an option even in the pre-collapse stage, like early class 3, potentially to delay or maybe even avoid the need for surgery altogether.
So there's actual evidence suggesting it might help reverse damage or at least halt progression.
Yeah, the sources point to studies where patients in early stages treated with HBO2 had significantly better outcomes compared to control groups, with many staying pain-free and avoiding surgery for years. And it's not just for hips. The data suggests benefits for AVN in knees and shoulders too. Plus, it's less invasive than something like core decompression, potentially lower cost initially.
And it could work together with other treatments.
It seems so. It can even be used after core decompression sometimes, in more advanced cases, perhaps working synergistically. This kind of evidence has actually led to it being accepted as a therapy option in Europe.
That's noteworthy. Are there specific recommendations on how to use it?
Yes, the sources stress the importance of selecting the right patients. Generally, it works better before the bone structure has collapsed significantly.
Earlier is better.
Definitely. And combining it with lifestyle changes is key, like reducing the load on the affected joint, especially during the treatment period. There are specific protocols depending on the stage.
Okay, so recapping. A vascular necrosis is serious. It's bone tissue dying from lack of blood, often in critical joints like the hip. Understanding the stages from class 1 with just pain up to class 4 with full collapse is really important.
Absolutely crucial. And knowing that there's a whole spectrum of treatments is key for anyone facing this, from managing symptoms to procedures like core decompression trying to save the joint, to therapies like hyperbaric oxygen, which, especially if used early, holds real potential to actually help the healing process by boosting oxygen supply.
So this knowledge, it really empowers you, the listener, whether you're navigating this yourself, supporting someone who is, or you're just curious about bone health to have more informed conversations and understand the possibilities.
Exactly. And, thinking about all this, it does leave you with a question.
Yeah.
Well, if early diagnosis with MRI is so vital, and these less invasive options like HBO2 might work best early on, potentially reversing damage or delaying major surgery. How do we get better at catching this sooner, especially in people we know might be at higher risk? How do we improve that early screening and diagnosis?
That's a really important point to think about. How do we make sure people get diagnosed early enough to benefit from these potentially joint-saving options? Something definitely worth considering.